I was diagnosed with celiac disease, which is an autoimmune condition that causes you to react to gluten in foods, in 2016. I found out through a phone call from my doctor, and my head was absolutely buzzing with questions. What is celiac disease? Is it permanent? How do I need to change my diet? And those questions didn't all come into my head during that call with my doctor. But what my doctor did do was to tell me about some reliable websites where I could find out more information in my own time. And that led to me opening up various reliable websites, including the Celiac UK website. And after about an hour or so of reading and consuming the information on those websites, I felt so much more in control of my situation.
I've got 2 children. With my first daughter, we found out she had hip dysplasia. The 12-week scan, obviously, huge shock. We didn't really know what to do. Thank goodness the doctor at the time managed to send us in the right direction with the websites and all sorts of links to different charities and different surgical procedures, and it was really important to be able to find credible websites out there with this kind of information to get us all through it, like we luckily did in the end.
When our family received a diagnosis with Tourette's syndrome, there was many questions that we had about this condition. And this is a condition which isn't very well understood in general society, in which certain assumptions are automatically made. We found that over the months since we've had the diagnosis, using high quality health information from a variety of sources, and in particular from one specialist charity, has really helped us to understand more as a family about this condition and help our friends and schools to learn more as well.
It's really important to me as a doctor that when I communicate with patients about their health conditions, that I have available to me accurate health information via patient information leaflets. I want these to contain the really important points that I would like a patient to consider, but I also want them to be patient friendly. I don't want them to be full of the kind of jargon that us doctors can often be guilty of using. An example of this in practice is when I consult with women who are approaching the menopause, or women who want to ask more questions about HRT, hormone replacement therapy. There is a lot to say in that conversation, and I am often conscious that I can often bombard a person with lots of information, and I can be left wondering whether they've retained everything I've told them. And so by providing good quality health content, I can be assured that at least they will have all the information to take away with them to make an informed decision about the kind of treatment they might want or not want, and then I can help them as a doctor move forward from that point on.